4, 3, 2, 1, blast off. Another rocket ship.
If we value our kids as we say we do, why aren't we paying the kind of wages that take care of those who care for those we love most?
No one is prepared to spend what needs to be spent on childcare.
It is tough to pay our workers what they are worth. We've sent them back to college in droves to get college-based early childhood education so that they meet the qualifications for our quality rating system. And we've had many, many wonderful successes in that area. But as soon as they then have their college degrees, they're eligible for much better paying jobs with better benefits, and that's part of why they leave the field.
And those that remain in the field are picking rocks.
In Wisconsin, fully 36% of our workforce of child care teachers are on some form of public assistance.
Child care teachers often go without health insurance and struggle famously to make home and car payments.
They do. And the state of Wisconsin has done a nice job of helping to support child care and early childhood professionals with teach scholarships, which is fantastic. But there are only so many dollars and they can only go so far, and they have waiting lists now too. So I have 5 teachers that are on teach scholarships and are working their way through college as they're working, most of them full time. It's a lot of stress, it's a lot of pressure.
On those who pay for care too.
So you have to start saving when you're 8.
She's not kidding.
So the Pew Research Center did a study looking at the cost of childcare and the cost of tuition at 4-year state institutions. And Wisconsin is one of about 30 states where paying for infant care for 1 year is more expensive than paying for the cost of your 18 or 19-year-old child being at the university. I have a son who will be going off to college next year. I have been saving to help pay for that since he was born. Literally, the Pew Research Center said you'd have to start saving when you're 8 years old to be able to pay for childcare when you start a family.
Those that are on the upper income level can afford to pay the cost of childcare, but the part of the population that we hear from parents calling us over and over again is they are unable to pay for the child care that is delivering the quality they're looking for their children. I believe that the parents that are hurting the most are the ones who are living below the 200% federal poverty level, so they do not qualify for support and paying for that child care for the Wisconsin shares.
So we're talking, we have a subsidy program that's for the very poor.
Well, and many parents are saying that child care isn't affordable, and they think that the programs are making money hand over fist, but in reality there is a very tiny profit margin. And if we have too much snow or if the furnace breaks down, the group centers may very well go in the hole. Their number one cost is either their building or staff, and they are paying them at wages that are not livable. I worked in the field myself as a family child care provider for about 17 years, and if I had not had a spouse with all the insurance and the benefits that one needed to keep their family going, I wouldn't have been able to stay in the field that long.
If we can't find a way to keep them in the classroom, then what we're doing is creating a system of care that's not really good for kids. It's not what kids really need to thrive at that age.